We have the frontal bone, the parietal, and the occipital. And the external occipital protuberance is where the muscles that keep the head upright and allow the head to tilt back attach. The temporal bone, we have the temporomandibular joint, which is where it interacts with the temporal and mandible. We have the mastoid process and the styloid process is right there. And the external acoustic meatus is here, and the squamous part. Internal, the petrous part of the temporal bone is here, with the that houses the internal and middle ear cavities with the internal acoustic meatus that cranial nerve 7 and 8 pass through right there. We have the superior, so if we move on to the sphenoid, we have the superior orbital fissure, which cranial nerves 3, 4, and 6 pass through. And that's represented by that dot there. We have the lesser wing and the greater wing. The optic canal right there at that dot. And the stella turcica is right there, and that's where the pituitary gland sits. And I forgot to mention for the optic canal, cranial nerve 2 passes through there. Moving on to the ethmoid, we have the crista galli right here, this ridge, and that's the point of attachment for the outermost covering of the brain. And the cribiform plate is right next to that. The holes allow filaments of olfactory nerves to pass from smell receptors to the brain. For sutures, we have the coronal, which is made up of the frontal and parietal. We have the sagittal, which is made up of the parietal. The lambdoid, which is made up of the occipital and the parietal. And then we have the squamous right here. And that is made up of the temporal and the parietal. Facial bones, we have the maxilla and the alveolar process there along the top of the teeth. The nasal is here, nasal bone. Zygomatic is here, and that's made up of the zygomatic bone and part of the temporal bone. We have the ethmoid, which is the upper part of this inside piece, and the vomer makes up the bottom part. So those two pieces make up the bony nasal septum. And the inferior nasal concha are very hard to see, but they're right here, there. And they filter heat and moisten inhaled air. The mandible is here, and we have the body, the angle, the ramus, the mandibular condyle, the mandibular notch here, and the coronoid process, which is right here, this piece. The vertebral column, the primary curvatures are the thoracic and the sacral, because they are developed at birth. The secondary curvatures are concave. That would be the cervical and the lumbar. And they're secondary because they develop as the child develops. There are 7 cranial vertebrae. I'm sorry, cervical vertebrae. Cervical. The atlas, and that articulates with the occipital bone of the skull to do this. What's unique about these are the transverse processes have foramen that allow the vertebral arteries to pass and service the brain. There are 12 thoracic vertebrae, and the spinous process can be seen here with the transverse processes on the edge. The intervertebral foramen is hard to see, but it's just inside there, and that's where the spinal cord passes through. Flipping them around on this side, we can see the body, and then of course the positions of the intervertebral discs. There are 5 lumbar vertebrae, and then we have the sacrum, which is composed of 5 fused vertebrae, and of course the coccyx. The manubrium is located here with the jugular notch. The body of the sternum is here, and the xiphoid process is here. Looking more at the ribs, we have our true ribs that attach on their own to the sternum. Then we have our false ribs that don't fully attach on their own to the sternum. And then we have our floating ribs, which do not attach at all. The head and neck and tubercle of the rib are difficult to see, but we can try it. We've got the head of the rib, followed by the neck, and the tubercle is hard to see, but you can feel it. And they articulate with the vertebrae via ligaments. The ligaments actually join the rib at the transverse costal facet, and the ligaments join the vertebrae at the transverse costal facet, and the rib at the tubercle and neck.